Good morning, everybody. New South Wales had 152,000 tests done in the last 24 hours, which is a huge record for the state. We had 345 cases of community transmission to 8 p.m. At least 60 of those were infectious in the community during that time. Regrettably, we had 2 people die overnight who had COVID, both men in their 90s. Both had a level of vaccination, and our deepest sympathy and condolences to their loved ones. One gentleman had had 1 shot of the AstraZeneca, and the other gentleman had had both doses of Pfizer, both in their 90s. And Dr. Marianne Gale from New South Wales Health will provide further details. In relation to the local government areas of concern in the Greater Sydney region, as we'd said, Fairfield and Canterbury Bankstown do remain the areas which are generating the most cases, but we are seeing some stabilisation in those local government areas. However, concerningly, the front has moved into Cumberland, and we're in particular concerned about the suburbs of Merrylands, Auburn and Granville. So to date, there are 9 local government areas included in those extra areas of concern with the additional restrictions. This morning, based on health advice, there'll be 3 additional local government areas which we'd foreshadowed yesterday to be included, which brings the total local government areas in the Greater Sydney area to a dozen. From 5 o'clock this evening, Bayside, Strathfield and Burwood local government areas will also be included in those areas of concern. In relation to Bayside, the suburbs of particular concern are Bexley, Banksia and Rockdale, where additional cases have been identified overnight. So if you live in those suburbs in particular, please come forward and get tested. But also, of course, in Strathfield and Burwood, which are geographically smaller areas, but we are noticing relative to the populations there an increasing number of cases. And as a precaution, those additional council areas have been brought into those areas of concern. We are asking also people who live in the inner west and also in Camden to be on extra watch and alert, and health authorities are watching the cases in those areas very closely. In terms of regional New South Wales, pleasingly, Armidale, Tamworth and Northern Rivers continue to have 0 cases, which is a positive sign. So those 3 local government areas or communities who are currently in lockdown continue to have 0 cases. Unfortunately, the same isn't the case for Hunter and New England, where there's been a number of cases overnight. And as a response to that, New South Wales Health has recommended that those local government areas which are currently in lockdown, including the Hunter and the Upper Hunter areas, will be extended by another week. So rather than coming out of lockdown tomorrow, that will be extended another week given the additional number of cases. And I think given what the area is experiencing, the community would understand why that's the case. In relation to Dubbo, I understand there were 5 additional cases overnight and 1 in Western New South Wales in the Walgett area, which is why those communities are currently subject to lockdown as well. Can I also acknowledge that yesterday in New South Wales we broke a record where 106,000 people were vaccinated. That is very encouraging. Can I thank everybody for coming forward? And pleasingly, we've seen people, especially in those local government areas of concern in Western and Southwestern Sydney, come forward for vaccinations, and that's exactly what we need to see. Can I please encourage everybody to come forward and get vaccinated? We know it will help us control the spread, but also ensure people stay out of hospital. Thank you. I should also say that Dr. Marianne Gale from New South Wales Health will provide the health update today. And we're also extremely pleased to have with us Dr. Murray Wright, who's the New South Wales Chief Psychiatrist. We know that lockdowns create stress for every single person, and he is going to give us an update on how best families and individuals can cope with what we're experiencing at the moment in New South Wales. And Deputy Commissioner Mick Willing from Police will also give an update on police compliance activities. So I'll ask Dr. Gale to give her report first, then Deputy Commissioner Willing, and then Dr. Wright, our Chief Psychiatrist. Thank you.
Thank you, Premier, and good morning, everyone. There were 345 locally acquired cases of COVID-19 reported in the 24 hours till 8 p.m. last night. There were also 2 overseas cases reported till 8 p.m. last night. Yesterday there was a record of 151,830,000 tests reported to 8 p.m, and that compares with the previous day's total of 119,256. So I want to say a big thank you to the people of New South Wales for turning out in such record numbers to get tested. We know that that's a message that we've been giving since very early on in the pandemic, but it remains a really critical message. And we want people to come forward for testing as soon as possible, even if they experience the mildest of symptoms. And so again, a big thank you to the people of New South Wales for coming out in such record numbers to be tested. And we ask you to please continue to do so as early as possible if you have even the mildest of symptoms. Currently, we have 374 COVID-19 cases admitted to hospital, with 62 people in intensive care and 29 who require ventilation. Of the 62 cases in ICU, 3 are in their 20s, 7 are in their 30s, 5 are in their 40s, 13 are in their 50s, 13 are in their 60s, 19 in their 70s, and 2 in their 80s. Of the 62 people in ICU, 57 are not vaccinated, and the remaining 5 have had 1 dose of either AstraZeneca or Pfizer. As the Premier has said, today we're sad to announce that we've been notified with the deaths of 2 people overnight. They are a man in his 90s from southwest Sydney who died at Liverpool Hospital. He acquired his infection as part of the Liverpool Hospital outbreak, and there are now 7 deaths linked to the Liverpool Hospital outbreak. The second case is a man in his 90s who died at Royal North Shore Hospital. He was a resident of Wyoming Residential Aged Care Facility in Summer Hill. He tested positive on July 31st and was admitted to Royal North Shore Hospital the following day, and he was fully vaccinated. As the Premier has already expressed on behalf of New South Wales Health as well, I also express my deepest sympathies to the families of those 2 gentlemen who passed away, and we recognise that these deaths are extremely painful for those families, and our heartfelt condolences to you. I'd like to also provide a bit more detail around Western New South Wales. As the Premier mentioned, we have a total of 6 cases currently in Western New South Wales, and 3 of those cases identified in Dubbo overnight. With the stay-at-home orders for those LGAs in that western area of the state, a really important message for all that community to please stay at home, don't go out, only if you have a reasonable excuse to do so. It's incredibly important to protect your families, your households, and just a reminder that your household really is those people who live at home with you, not broader family members. I also want to say a specific call out to our Aboriginal community. We know that many of those affected areas have a high proportion of Aboriginal people, and I ask all our Aboriginal community as well to please stay at home, come forward for a test if you have symptoms, and of course please get vaccinated with any available vaccine as soon as you can. Finally, I'd just like to provide a bit more detail around the Hunter New England cases. There are 24 cases across Hunter New England LHD. 12 of those are associated with a residential aged care facility, RFBI Hawkins Masonic Retirement Village in Edgeworth. And that outbreak includes 11 residents who are COVID positive, 1 staff member, and we've recently been notified of 2 additional staff members. Those 11 residents are all now being cared for at John Hunter Hospital. 3 are receiving some treatment with oxygen, and none are in ICU. Thank you.
Good morning, Premier. Good morning, Minister. Good morning, ladies and gentlemen. Now, I know that you will all have questions in relation to what additional compliance measures may be required in this situation. I can inform you that I've spoken to the Commissioner Fuller this morning. He is working with a team of government officials and has been consulting, including public health, I should say, and has been consulting with the executive and region commanders across the state to determine what those additional measures may look like. He'll present back to Crisis Cabinet tomorrow afternoon. What I can say is that our ongoing compliance operation is occurring across the state. Just in the last 24 hours, 407 people received infringement notices for breaches of the public health order. 176 of those were, again, for not wearing a face mask. 56 people were charged with breaches of the public health orders, and police continue to respond to large numbers of calls to Crime Stoppers in relation to breaches of public health orders, 1,200 in the last 24 hours alone, and we've checked on over 2,700 individuals. So those compliance operations are ongoing at the moment. We are still seeing people who are willingly or recklessly not abiding by the current health orders. Just this week, we saw a person travel out to parks in breach of a public health order without a reasonable excuse. Yesterday, 2 businesses in the Mullumbimby area received infringement notices because of breaches of the public health order. So it's still ongoing. What I can say, obviously there are additional local government areas that are the subject of restrictions at the moment. Emergency management arrangements have been stood up in Western New South Wales, in addition to those that are currently in place in the Newcastle area and indeed across Greater Sydney. Those emergency management arrangements are there to provide support to those communities to ensure that they get through this current period of restrictions with as much support as they possibly can. Thank you.
Thank you, Premier. Good morning, everyone. My name is Dr Murray Wright and I'm the New South Wales Chief Psychiatrist. We all know that from a public health perspective, that the lockdown is for the purposes of reducing the spread of the virus during the pandemic. But it's really important for me to take this opportunity to remind everyone that this is probably the most sustained and serious stress that many of us are going to face in our lifetimes. And how this impacts on us and how we manage it is going to be really important in minimising the sort of the well-being and mental health impacts of the stress. There are some fairly simple and straightforward things that we all need to keep front of mind on a daily basis in order to manage these stresses, keep track of how it's affecting us and the people around us, and also to access help if needed. So, in simple terms, what people need to do is to have a plan to manage their stress and to monitor it and to review it on a regular basis. It is straightforward, you've all heard about this before, but it bears repeating, and it actually bears repeating almost on a daily basis. It's like a reset. It's also helpful to assume that everyone that you come into contact with is also dealing with the stress and is impacted by the stress and may not be responding to the things around them in their usual way, and if at all possible, cut them a bit of slack on that basis. So the simple things that we can all do is firstly, have a plan and to create structure in your lives. Particularly in a lockdown, many of us have lost that structure and it's important to recreate it. And that structure includes having regular daily exercise of some kind, having contact with the people who are important in your life, and talking about meaningful things, including how they are coping and how you are coping. It's important to monitor things like your diet, like your sleep, like your alcohol intake, and also to set goals every day and review that. Now, none of us always execute the perfect plan, but it's important to review it and it's important to renew it on a daily basis. If things are not working, and the signs of things not working include difficulties with sleep, difficulties with concentration, feeling unduly fatigued, feeling overwhelmed, feeling irritable, or consuming too much alcohol. And if any of those things are happening, either to you or people around you, you should make it a subject of consideration. What can I do to change to change how I'm approaching the day, or do I need help? Ask people if they're okay. That never does harm, and it often does a world of good. And and making it a regular subject, as well as talking about the pandemic, talking about well-being is really critical for all of us. It will minimise the impact, and it will minimise the long-term impact of mental health issues long after the pandemic is gone. We've gone to some trouble in the New South Wales mental health services to adapt to some of the restrictions that the pandemic has brought. There's been an investment in services like increasing availability of telephone help services, so even in isolation people can access help online. There are online organisations like Beyond Blue which have some specific advice for managing with the pandemic, and in our clinical services we've invested in increasing the capacity for telehealth. So our services are open for business, and we don't want people to stay away on the basis of the pandemic if you're struggling, and we expect that people will struggle from time to time. Look out for the people around you, talk about what you're doing about it, and reach out for help if you need it. Thank you.
Premier, are you looking at calling in more ADF resources? What role would they play and how many? And are you considering a ring of steel around Sydney? What other measures are you looking to tighten?
Yes, certainly. And can I say New South Wales Health and Police have been involved in dealing with the pandemic from day one, and we're making sure that we don't leave any stone unturned. In relation to extra ADF resources, of course, the Police Commissioner always has that opportunity to ask for more, and I suspect he will. And I can also confirm the Health Minister has written to his federal counterpart asking for ADF to support us in having additional vaccination clinics administering AstraZeneca. We want to make sure that we have enough points of access across all of New South Wales, in particular in and around those areas of concern. So please know that I assume Police Commissioner Fuller will ask for more ADF support as things continue. To date, ADF have already been involved in supporting police on the ground in those areas of concern through the structures we have. And can I please thank the police, the ADF, the public health, and also all the community organisations that have been working hand in hand. And in areas like Fairfield and Canterbury Bankstown, whilst they remain areas of concern and we're getting a lot of cases, we are seeing stabilisation there, and that's because of the intense activity and efforts. And obviously that is now also in place in a number of local government areas across Sydney, but also in our regional communities where specific populations need that whole of government support and approach.
With the 3 extra LGAs now there are 12, the complication that does bring, is there consideration being given to placing the whole of Sydney into that tighter lockdown?
Oh, look, if we get advice to that, of course, New South Wales Government will consider that. At this stage, we're continuing with the approach we have, and we're asking everybody to please do the right thing. We're seeing the front of the virus move forward into these additional communities, and we're just asking everybody to make sure they respect the health orders, do the right thing to protect themselves and their communities. As a precaution, New South Wales Health asked us to put those additional 3 local government areas in. Some have only had 1 case overnight, but as a precaution, we want to stop the front of the spread moving forward, which is why we accepted that advice.
Premier, you've brought in the Commissioner to have another look at tightening the public health orders and addressing some of the gaps. Can you give us a sense of the sorts of gaps that you want to see closed in those current health orders?
Well, just to stress, the Commissioner's been asked to consider what additional measures he would like to support compliance efforts. And we know that Delta doesn't leave any room for error. Even a handful of people doing the wrong thing every day can cause major setbacks. So if there are additional measures that can increase compliance measures, well then of course the government will accept that, and the Commissioner has always had that opportunity, but of course we've asked him to really ramp up what activity he wants in relation to compliance. Let us know if there's additional resources he needs, but also let us know if there's additional measures we can introduce to make sure we don't leave a single stone unturned. So it's really about making sure that compliance can be dealt with, because even a handful of people doing the wrong thing is causing major setbacks. And I acknowledge the vast majority of people are now doing the right thing. Some of those areas of concern have nobody in streets. The streets are bare. But we know it only takes a handful of people every day doing the wrong thing to cause major setbacks. And we are in a very difficult situation, and we want to turn the tide, and we're not leaving any stone unturned. So if the Commissioner comes back tomorrow and the following days and says he needs X, Y and Z, well, of course, we'll consider those.
Has the singles bubble become too hard to police? The singles bubble?
Well, look, I think it's really important, as Dr. Wright said, that when we are considering these lockdown measures, you also have to consider not just keeping people physically healthy, not only trying to allow businesses to get the support they need, but also look after people's mental health. And with any health order, there's also a degree of responsibility we ask people to make. We allow the singles bubble in place, or put it in place, to provide that mental health support for people who are on their own. It's difficult enough being in lockdown, let alone if you're by yourself. And so we ask people to follow the rules. But as I said, it only takes a handful of people every day to do the wrong thing, to create setbacks for all of us. And we're still recovering from gatherings which were illegal. We're still recovering from people who did the wrong thing, because that has a cumulative effect day on day. And that's why we've asked the police to look at any measures that we can support them with to ensure a greater level of compliance throughout all of New South Wales.
Premier, we just heard the Deputy Chief Health Officer say that imploring Indigenous communities to come forward and get the vaccine. You can understand the frustration there when they had in that region some Pfizer shots redirected back to vaccinate Year 12s. What are you doing to rush supply back into these areas that are now under lockdown?
As we said, all of those vaccines had already been returned. So I want to assure communities that we are making available all the vaccines that we have available. And I really want to thank communities for responding. The uptake in vaccines in New South Wales has been outstanding in the last week. Yesterday, we had a record 106,000 people in one day get a jab. And that is really positive. That's the hope that I cling on to, because higher vaccination rates protect people from ending up in hospital, but they also help us in stopping the virus spreading even further, because we know that even one dose of either vaccine helps reduce how contagious you are. And when you have a major outbreak, as we do in New South Wales, it's really important to try and do everything we can to reduce how contagious people are, but also to keep people out of hospital, because protecting life is really critical. Obviously, that's an understatement, but that is our objective, to keep our communities safe. That's why we are in this difficult lockdown. That's why we have the strict rules around the state, and that's why we're asking people to follow the rules. And again, I want to bring home this message. I think we've started to see a turnaround in some communities, because people are realising you might think you're okay with the virus, but your close loved ones won't be. And you could then go home and give it to those you care about the most. And it's been horrific seeing the despair in families when people have brought it home and they've lost somebody closest to them, and the guilt that people have knowing that they've infected their loved ones lasts a lifetime. So not only do people have to live with the consequence of losing a loved one, but living with the guilt for the rest of their lives. That is not something I'd wish on anybody, and people are starting to get that message. When you get the virus and take it home, you're giving it to those closest to you, and we've seen some families have more than one death. We've seen somebody bring it home, and unfortunately more than one person has died in those families. We don't want to see that anymore. We're just asking people, please don't break the rules, because Delta leaves no room for error. It is so contagious that if you're not vaccinated, it leaves no room for error, and we just ask people to think about that. I'll come back in a second, yeah.
South Australia's offering Pfizer, I think, to over 16s.
I'm sorry, I didn't hear.
South Australia offering Pfizer next week to under 39s. It's 16 to 39, I'm not sure the exact age groups, but can we look at doing something like that here as well?
Well, obviously, what the advice from the public health team, from Dr. Chan's public health team, is to get as many first doses in our citizens as quickly as possible. So we have a strategy whereby we're trying to get those first doses in our communities as quickly as possible, and delaying the second dose of Pfizer, and bringing forward the second dose of AstraZeneca. So our strategy is really about maximising at least first doses, and it's important for us, therefore, to in particular vaccinate younger people, which is why we are targeting HSC students throughout those local government areas of concern. To date, I understand we've done just over 10,000, or will be, which is positive, and we're looking forward to more coming forward. But certainly we're maximising use of both vaccines. We're keen for people to come forward and get vaccinated, no matter how old they are over the age of 16. And it's really important for us in controlling this pandemic to have those high rates of vaccination amongst younger people. And I, in particular, want to thank younger people for their understanding and for their patience. I know how fearful some have been in coming forward and getting vaccinated, but we thank them. They're coming forward in droves. And we also appreciate that for young people, getting the foot in the career ladder or getting your education qualification or having an active social life are things that the lockdown has prevented. And we especially are grateful. That's why so many are coming forward to get the vaccine. And we're maximising what doses we have available. We'll know we'll be getting extra vaccine in September, but until that time we're making the best of what we have, and I just want to thank everybody for coming forward and getting vaccinated.
Pfizer access from next week.
I don't understand the question, I'm sorry.
Pfizer
Yeah.
access 16 to 39 for the entire community. When could that be expected?
Well, obviously we have a ration of Pfizer doses, and they are automatically approved for various categories of people already. And that's being implemented. So that's already in course, and that's why also we're using Pfizer obviously to vaccinate HSC students as they can't take AstraZeneca. But we're asking everybody to come forward and get the vaccine that's available to them, and if anybody has concerns they can consult their GP. But we're also asking people to utilise the pharmacies. They've been outstanding. Can I in particular thank the Pharmacy Guild of Australia and New South Wales? They have really stepped up and supported our efforts in getting people vaccinated. It's been amazing. And we're hoping more and more pharmacists will come online, especially in our rural and regional communities as well. When people live a long distance away from an established hub, it's a positive relief to know that a local pharmacist might be providing that vaccination.
Given now the risk of the virus getting into Indigenous communities in Western New South Wales, have you looked at the vaccination rates in those communities? Because they should have all been done, they were 1B.
Exactly, yeah. We have been looking at that, and of course those communities would have had access to vaccination earlier on, but we're making sure that we have sufficient vaccine to provide those vulnerable communities and working with those communities in Western New South Wales. I'm sorry, Clinton.
Regarding the military's involvement in vaccination...
I'm sorry, I didn't hear the question. Sorry, Clinton. Yes.
Regarding the military's involvement in vaccination, what would that look like?
Well, obviously, logistically, any additional points of access would be useful for New South Wales. So it might involve them setting up an additional hub using their logistical expertise, especially in relation to dispensing the AstraZeneca vaccine. So we are using every single resource we have, and obviously keen to see as many points of access as possible. We also know that many communities are responding to word of mouth and just turning up without making bookings, and we want to make sure we have additional points of access for that to be the case. I'll come back. Sorry. Yeah.
There's been confirmed number of cases within staff, nurses and other staff at the Nepean Hospital. Some of them have raised concern that they got an email from management saying that those who were exposed should isolate unless they're rostered on to work. A lot of the staff there are saying that they're worried and frightened and say that management doesn't really have their back, particularly that they're frontline workers. Should there be other protocols for hospitals? It doesn't seem like they're following the rules for nurses. What are we doing to make sure that they're safe?
Yeah, can I ask Minister Hazard to answer that question if that's okay? But I'll just start by saying, can we thank all of our frontline workers, especially our nurses, for the role they're playing in dealing with the outbreak. And please know that when we think about the health and safety of our citizens, we automatically think of those staff we're asking to work on the front line in our hospital system, and they bear the greatest risks, their families do, and I just want to express my gratitude to all of them. I'll ask Minister Hazard to answer that question.
Thanks, Premier. Good morning. Look, we did talk about this yesterday. Nepean Hospital Mental Health Unit, it's a dedicated mental health unit. And I want to thank, by the way, all of the staff at that particular hospital, not just in the mental health unit, for the work you're doing, because there's enormous pressure on you at the moment, and as Health Minister I understand that, and thank you very much. The mental health unit has approximately 30 to 31 patients at any one time, and those patients obviously intermix with each other during the course of the day. I think it was the 4th of August, a lady came into the hospital who had no symptoms, and she was admitted with obviously mental health issues into the mental health ward. 2 days later, approximately, she became febrile, so she got a temperature, and at that stage it became apparent that with testing she was COVID positive. Now that obviously creates pressure because there were cases that were positive, or a case that's positive in that ward, and the staff had to be brought in under full PPE. There were discussions that took place with the staff about how they'd try and manage the situation. I spoke again. I spoke to the operations manager there yesterday. I've spoken to him again this morning. It is a challenge. You can't walk away from the fact that it's a challenge in that situation, because the balancing act is looking after mental health patients who have, in some cases, quite severe dissociated thoughts, and a very, very professional group of nurses and staff who manage these patients in the normal course. Because there's COVID, they now have a number of staff that have had to go off. What they would refer to as furloughed, or been put off for a little while for the period of 14 days, and that's created some issues. I was assured this morning that they do have a complement of staff. They've had to make a very difficult decision in terms of closure of the mental health, the smaller unit up in the Blue Mountains, and a number of those staff are now assisting down in the Nepean mental health unit, and in addition they've also had to seek assistance out of the general hospital, so they also have a number of general nursing staff there who've come over and obviously wearing full PPE as they manage those patients. Patients who are positive, clearly positive, have been transferred into the COVID ward, the dedicated COVID ward at Nepean. And look, can I say this is health in a pandemic. Managing a health system is very, very difficult. One of the access points that is obvious is hospitals, because people who are positive come into hospitals, hopefully knowingly, but sometimes not knowingly because they're not symptomatic. And we've talked about this ad nauseum, that unfortunately patients or people who have the virus can actually have it with absolutely no symptoms. But they then can, of course, pass it on. It's worldwide that hospitals have been under enormous pressure. Our hospitals are now under a substantial pressure. Nepean is under substantial pressure. I want to thank the staff who've come from those other wards. I want to thank the staff who have come down now. There were some issues yesterday that I talked about yesterday, but there are a number of staff who are now backing in the staff at Nepean in the mental health ward and looking after the patients. And it's a difficult task. We heard earlier in the week Dr. Totoro talk about what it was like with an ICU specialist trying to look after staff who are look after patients who have the virus. It's no different if you're in a mental health ward, except that the complexity is even more, because obviously there's the mental health issues plus generally looking after the patients. But at this stage they're doing what they can, and I'm satisfied that the operational team there have done what they can, and thank them for that. And hopefully that will continue the way I was assured it was this morning. Sorry, could I go to you, Ursula, first, and I'll then Lucy? Yeah,
could I ask you, it's a slightly unusual one, and I apologise if I mispronounce this, so bear with me. Monoclonal antibody-based therapies, I understand drugs for like breakthrough infections, etc. Are you satisfied that federal health authorities are buying enough of these? Have you heard that we have got those coming into the country, and what difference would they make?
Look, the federal government and all the governments around the country are looking at a range of treatments. So not a vaccine, but a range of treatments that are appropriate. I don't have the specifics on whether or not the federal government, where we're up to with that, but I can assure you that they're looking at a whole range of treatments for patients. But again, that's a worldwide phenomenon. Lucy?
Is the decision to revise the public health orders an acknowledgement that there were some loopholes that perhaps needed closing, and what are they likely to be?
Well, I think you've stood here almost every day, and we've had journalists who've delighted from time to time in trying to find loopholes. I think that public health orders are a big challenge. I mean, because public health orders have to be literally done in regard or in response to an urgent situation. Almost daily we're looking at them, and we have the health teams looking at the issues. We have the police who, by the way, worked with us almost from the start, and they've been with us working on those issues. I think that we will always have a situation when most legislation, and it's not legislation, I heard a number of journalists today referring to it as legislation. There is legislation which is the Public Health Act, and that was put into place in 2010, 2011, and thankfully it's worked very well here in New South Wales to provide the structure for the public health orders. But public health orders have to be created sometimes in a space of hours to address the issues that we see arising. and there will always be the possibility that there are ways through and around them. And I think I've said that many, many times. But also, as the Premier and I and Dr Chant and Dr Gale and all the others have said, and the Police Commissioner himself have said, that really it's not about the orders as such, it's about the community getting on the journey and being with us to make sure that they do what is a logical public health response to a pandemic. And that is, when you're asked to stay at home, stay in your household, stay at home. If you're asked to go and get tested, go and get tested. If you're asked to have the vaccine, please get the vaccine. And I think there continues to be some reluctance around some areas on that front. I would just say again, go and get vaccinated. But we'll work. I mean, can I say I welcome the, I know Commissioner Fuller and Deputy Commissioner Willing behind me and Deputy Commissioner Warboys. We've lived this for 20 months together, and I'm delighted that there's some more work being done on that and helping our health team. But it is in the end a health decision which will be worked through with a range of people, including the lawyers, the police and so on.
Can we just pick up on Alex's...
Well, we don't know that there's we don't know what's coming. What we know is that we're all working together, and we have been working together. So no, I welcome it. I think that it's a bit more energy and effort in, because what we are seeing is a very, I want to emphasise, 99.9% of the community. Thank you, because you are actually complying with what we've asked of you, and not necessarily in health orders, but when we ask you to do it, you do it. That's why we have had 20 months of, until the last few weeks, we had an amazing response here in New South Wales, but obviously the Delta variant is a lot more, it's a lot more ferocious, and that's a worldwide phenomenon. I mean, I think that's just the nature of Delta. So what we're looking at, working with Commissioner Fuller, Deputy Commissioner Warboys, who I've got to say has been outstanding. Most of you would have seen him here stand day after day. When you see him here, that's after he's probably done hours of work in the morning, and he's still here usually till 8 or 9 o'clock at night. So we're working on these issues all the time. But I think just stepping it up that little extra bit, we'll have a look and see how we go.
Are you confident that there are enough resources on the ground in health services in Western New South Wales if there's an outbreak in Walgett and in those areas?
No, I'm not. I make that very clear. I wrote to the federal government last night, and I thank Minister Hunt for responding. You heard Dr Gale refer to the fact that in some areas that we had to make urgent decisions again on last night as a result of a particular case that initiated other cases. There are very strong Indigenous communities. I think the second biggest building in Walgett is actually the Aboriginal Medical Service, and I know, because I received text messages last night, that they're short-staffed, like everywhere else in the health system at the moment. And I know that they would like to have access to more staff and vaccine. Well, we have had the continuing problem in Australia that whilst I think the federal government did everything possible to try and get as much vaccine earlier on, I know there's been criticisms of them about that, but I think they did. But we have practical problems of getting vaccine into our country because it's still worldwide, probably the most popular product on earth, get some vaccine. So we have had limited supplies coming into New South Wales, and that's created all sorts of work issues for us in terms of delivering vaccines. You can't deliver what you haven't got. And in Walgett, there have been similar issues, but I spoke to our most senior health officials late last night, and they were talking about trying to get some access and reallocate, if we can, to that priority area of more vaccines into that area. But I also wrote to Minister Hunt and pointed out that obviously the Aboriginal population was identified by the federal government as its area of responsibility earlier on in the 1A, 1B, 2A, 2B, and there's still a very substantial percentage, in fact by far the majority of Aboriginal people in that northwestern section of our state have not received the vaccine. And well, you'd have to direct that to the federal government. But I've actually asked for help on that front. Look, can I say, actually, I think priorities. I think that you know, it's not appropriate to blame the federal government or blame anybody really. It's just a matter of when there's limited vaccine supplies, decisions have been made, and up until the last 48 hours, Northwest has been not the highest priority by any means. So, but now, obviously, because somebody has unfortunately got the virus and not necessarily complied with what we've asked them to do, there's now an issue. So I've asked them to assist, and I've asked them whether it's possible to have any pop-up vaccination clinics, whether it's possible to have some ADF staff, medical staff, support us in that area. And effectively, it's, as I said, it's primarily their responsibility, but we've been helping as well substantially over the last 20 months. It's a team effort. So, you know, I think and they've responded very quickly. I think I had Minister Hunt respond within minutes to say they would see what they could do and try and get onto it. So I think we just got to hope that everybody's got enough staff and enough vaccine to be able to get up there and do what we need to do.
Given you've got what you've got...
sorry, can I go to Clinton first and then you? Is that all right?
Given you've got more and more regional areas now moving into lockdown, is there consideration for the whole states to go into lockdown?
Oh, look, I think the one thing New South Wales has done extremely well, we've done, our staff, I want to thank them, they've done an amazing job. Let me not make this any criticism, our staff have been amazing and they have responded extremely well. But I think there's a defining difference, I'll put it that way, between New South Wales and the other states, and that is we've always tried to keep as much of New South Wales open as is possible. And we will progressively take the advice of our public health team on areas that are of concern. And as I said last night, I think Dr. Chant actually said to me at about 5:30 or 6 o'clock there was a case that had come out of a prison in Dubbo, and unfortunately there were major risks to other areas. And I think by 7 o'clock we had orders in place, which is amazing because that required the lawyers, the health team, everybody, and of course health team on the ground. So there were lots of conversations occurring with the public health staff and the health staff generally right across the northwestern sector. We were discussing with the local members and other community leaders, and they responded very quickly. So I think we're doing everything that we could possibly do as quickly as possible, and we will progressively look at those areas that have problems. But at this stage, I don't see any reason, on the advice I've had to date, I don't see any reason why we'd move further than where the problems are or are likely to be. Sorry, I promised I'll come to you in a second.
Sorry, can we just get a little bit more details on the person who was fully vaccinated who died? Is there any more details on that as to the situation, or...?
I'll let Dr. Gale answer that. She may have more information. I'm sorry I don't have that information, but again, can I just say also my sympathy to the families. It's just terrible when we lose a loved one, and no matter what the circumstances are, it's awful, but in a pandemic, my sympathies also to those families. Liz, sorry, I think Liz...
Just to pick up on Alex's point earlier, we need absolute clarity on this, because under 40s there are lots of people in their 20s and 30s who think they will eventually get Pfizer. It has been approved for under 40s in South Australia, Northern Territory, WA, they're dishing it out. Are under 40s here going to be able to get Pfizer in the next couple of months, or is the advice for them you cannot hold out hope for a Pfizer jab, you need to get AstraZeneca?
I think the strong advice is that the Pfizer, both vaccines are what I would say to everybody is both the vaccines are worldwide winners when it comes to stopping death and hospitalisation. And both vaccines are very, very effective. Both vaccines, after the first dose, within about 21 days, you get about 70% of efficiency or efficacy, as the medical people refer to it.
We just need absolute clarity on whether they should wait.
Let me just finish, please. And so the message there is to get vaccinated, because 21 days later you have about a 70% chance reduction of going into hospital or dying. So both vaccines. Can I say in regard to the broader issue, obviously younger people or older people can have either one of the vaccines, but at the moment we've made clear what we're focusing on here, and it's the public health advice. And we'll continue to follow the public health advice because we just don't have enough of the Pfizer to do every group at the moment.
So no.
What is that?
No.
Dr. Gale, do you want to answer that?
So in relation to vaccination, clearly the advice is for all in our community who are eligible for the vaccine to really try to get the earliest access to whichever vaccine that you can, be that AstraZeneca or Pfizer. So essentially that is the health advice. So for all in our community, please get vaccinated as soon as you can with either the AstraZeneca vaccine or the Pfizer. Perhaps in relation to the earlier question about the gentleman who sadly passed away, he was fully vaccinated with the Pfizer vaccine. We don't have a whole lot more details about the case, but we do note he was a very elderly gentleman in his 90s. I don't have the detail about his various health conditions, but I think we can understand that people in their 90s are frail and vulnerable, so that's what we do know at the present time.
Doctor, when your contact tracers identify a close contact and you speak to them on the phone, do contact tracers tell them that they are eligible for financial assistance while they quarantine for 14 days?
That's a good question. I'll have to double check that information as to exactly what they're told, but I'm happy to look into that and get back to you.
Do you know what the financial assistance is?
Well, look, I'll have to go through the detail of that, and I guess it depends on a person's individual circumstances. And so the team would have access to all of that information, and I know that they certainly do their best to support anybody who they come in contact with, whether that's a case or whether it's a close contact. And they do discuss in detail with those individuals about their personal circumstances, what their needs might be. Do they need an interpreter? Do they have access to food and other supports? Do they need to be isolated away from others in their household, in which case other accommodation would be needed? So I'm confident that our teams, do go through those issues thoroughly with anyone who needs to isolate, be that a case or a close contact, and I'm happy to provide further information about the specifics of the advice around financial assistance.
It's a $1,500 flat grant for anyone who is isolated for 14 days. Is that something that needs to be on the absolute checklist for New South Wales Health contact tracers to say, please stay home, we're giving you $1,500?
As I said, I'm happy to go back and look at the detail of exactly what advice people who are in isolation are given, and very happy to look into that and provide further advice.
And just to be clear, for a person who is under 40, if they are told you can get a Pfizer appointment but it won't be until late October, should that person, given the threat in New South Wales now, should that person just say, okay, I'm going to get AstraZeneca instead?
Look, it would be my advice in the current situation, and we always as public health look at the risks and benefits, and it would be my advice in the context of the outbreak that we're currently facing, that all individuals should strongly consider getting vaccinated at their earliest convenience with any available vaccine. And if they have any concerns about the choice between Pfizer and AstraZeneca, I'd encourage them to talk to their GP. There's information available on the website about risks and benefits, but I would strongly encourage anyone of whatever age to get vaccinated as soon as they can, and if they have any questions, please talk to their GPs. Thank you.
Just on South Australia making their Olympians double quarantine in Sydney, and then when they get home, what do you make of that decision?
Oh, look, that's a matter for the South Australian government, but in all of the stress that New South Wales is under, we're still welcoming home our Olympic athletes through Sydney, and obviously they've got to do a mandatory quarantine period, after which time they're available to leave our quarantine system. I can't really control what other state governments do. That's for them.
All of Bayside into the whole LGA into this harsher lockdown. Yeah. Penrith was a number of suburbs. Obviously in Bayside, the western part of Bayside's a problem. Eastern part, Botany, 0 active cases.
Yeah. The health team consults their health professionals and also community leaders in relation to what people's movements are, where the centre of community is and activity is. So in some communities there's definite boundaries where people don't tend to go beyond, but in other communities they're so interconnected that it's really difficult to control the virus unless you incorporate a bit more. And in the current environment, it's fair to say that the health advice to us is very precautionary in that it'll go a bit further than what might be required in order to prevent the spread, and I think the community understands that. We want to put as much focus as possible on preventing additional cases, because what is known as the R effective, which tells you how many cases you're likely to get, is above 1 in New South Wales. That means we're likely to get more cases than have the case numbers go down. Until we get that R effective below 1, we know that case numbers are unlikely to come down, and that's why the health advice is precautionary, to try and get what we call that reproductive or the R effective measure down as much as possible to essentially stop the stem of the spread, as opposed to seeing additional cases every day. And given in the last few days we've seen a cumulative number of in excess of, clearly in excess of 300, we're likely to see that continue unless we take those extra measures, whether it's precautionary in terms of asking further local government areas to go that bit harder, or whether it's asking police to go harder on compliance. And if there's anything else we need to do, we're throwing everything at it, because it's a really critical time for us to make sure we stem the tide of case numbers going up. And at this stage, it's likely they will, unless, of course, these additional measures are put in place, which is why we're doing it.
Premier, we've got essential workers now from these 12 LGAs that are having to get surveillance testing every 3 days as part of the rules. The pathology labs are already under significant stress, and there are people who have to wait several days to get a test back. Are you concerned that this is going to blow out the amount of days that it's going to take for someone to get a test back now that we've got so many more people doing testing every 3 days?
Yeah, look, there's some of the issues our public health teams look at, because obviously we're pleased that so many people are coming forward for testing, but it does slow down the system. But what we have found with what we call surveillance testing, so authorised workers from various local government areas have been asked to do that 3 daily test, we're finding people without symptoms turning up positive. So we know that in many examples, the spread is being stopped because people are actually caught up in a positive way in that surveillance testing. But you're right, that has to be weighed up with some unintentional delays that may be caused. And that's why it's really important for us to have very targeted messages about who should get tested in what circumstances. But the fact that we've got 150,000 tests is beyond any of our expectation in a day. So we know that part of that is the surveillance testing, part of that is because people are absolutely doing the right thing and coming forward for testing. But obviously it does put extra pressure on pathology systems, it does put extra pressure on getting those quicker turnaround times. But I want to assure everybody that the public health team notifies positive cases as a priority. So if it's taking a bit longer for you to receive the official advice after you've had a test, chances are you're negative. But obviously the public health team jumps on top of the positive cases as a priority, and you'd understand why that's the case.
Would you consider every 5 days?
I'll go one more each. Yeah, sorry.
Just on the singles bubbles, many people who live alone across Sydney would have had a selected single partner in one of the new LGAs. Can those single people now pick a new visitor, given that their previous person is now presumably off limits?
Well, we don't. I'll have to take Dr. Chant or Dr. Gale's health advice on that. But the whole purpose is you cannot change your designated person, because that will increase the likelihood of spread.
So if they're in that new LGA,
look,
then you can't get another one.
If there's any changes, we'll notify you. But the whole purpose is to have the one designated person, so not to have different designated people, because obviously that increases the chances of the spread. But of course, the strong health advice is do not go anywhere near those local government areas of concern unless you absolutely have to. But our recommendation would be just avoid those areas where we know the virus is circulating as a significant proportion.
Are you going to extend the moratorium on evictions?
Yes, I understand that's already in place.
And there were, overnight though, just in terms of the Service New South Wales backlog, as fast as the backlog's being cleared, it's banking up again. So yesterday 5,000 were approved, but it was received of 8,000. So it's actually banking up faster than how are things going in clearing?
Yeah, the good news is they're processing thousands and thousands of applications every day, and I understand definitely by next week that the backlog will be cleared. 90% of cases are being dealt with in quite a quick way. There are some other complex ones, but let me assure you, Service New South Wales has been literally working 24/7, and I understand around $1 billion has gone to small to medium-sized businesses to support them during this time, and I just want to thank everybody for their patience. But please know, if you're eligible to get that support, you will. And for anyone who's experienced frustration or delays, I apologise profusely. The last thing,
how the backlog's being cleared, just because by sheer numbers they're mounting up faster than they're being approved. So have you got more staff on? Or
we obviously know that there's additional businesses that are now applying. So there's a combination of things. There's additional frontline staff. There's additional expert accountants, which we've brought in to hurry up the process. If there are any questions, they're being dealt with very quickly. And we also have systems upgrades in the back office as well. So it's a combination of things that have occurred to deal with the the challenge, and I just ask people to stick at it. Don't give up if you ring and you find that you're waiting too long. As I said this morning, I understand the average waiting time is 18 minutes, which is still very long, but obviously as we clear the backlog, we want that to reduce substantially. So again, I apologise deeply and profusely to anyone who's experienced that stress. Lockdown is stressful enough without worrying about food on the table, and I just want to say to everybody, the money is there, it's available, and thank you for your patience during what is a horrendously difficult time. And can I just again thank Dr. Wright, who's here as our chief psychiatrist. I think what he had to share with us is absolutely essential and important. And don't underestimate the impact this is having on all of us. Some react in different ways to others, but we can't pretend our lives haven't changed because of this lockdown. And no doubt we know the next little while is going to be increasingly stressful. And I just ask everybody to take care of your mental health as well as your physical health, as well as worrying about, well, one thing we want to lift your load on, one thing I want to lift your load on as the Premier is not to have to stress about the dollar coming in your bank account, the dollars coming in. That's a stress we want to take away from you. We can't take away some of the other stresses, unfortunately, but in relation to financial support, please know they're all there. And if you are desperate and not getting what you need, call either Service New South Wales or our hotlines. And in various communities, community leaders also have been given additional support through non-government organisations to provide direct help to people who are doing it tough on the ground.
Very quickly, why you decided to bring Dr. Wright today? Like, are you concerned about fatigue setting in? Are you concerned about suicide rates? What's going on?
I think it's really important for us to acknowledge that the effects of a lockdown are all-consuming, which is why we asked Dr. Wright, our chief psychiatrist, to be here today. Please acknowledge, no matter how strong you think you are, how stoic you think you are, or how strong you think people around you are, every single citizen in our state has been affected one way or another. Whether you're having to work and homeschool, whether you're just denied doing the basic things, the basic personal care things you're used to doing. I mean, there's a whole range of things that are affecting people. And long-term isolation is difficult for anybody, let alone under these circumstances. And many other people are living in fear of the virus itself. Some people are just scared of getting it or scared of getting the vaccine. So there are a number of challenges we're facing individually but also collectively. And I just want everyone to feel comfortable to acknowledge it, to know that they can get help. As Dr. Wright said, there's obviously the New South Wales Health Services, which we've beefed up, but there's also amazing non-government organisations like Lifeline, which we're supporting, Beyond Blue, and many other organisations at state and federal level who are provided that additional resource. So we just ask people to pay additional attention to their mental health needs, additional attention to keeping themselves well. That's why the exercise provision is there in the health orders. Exercise is so important, routine is so important. So as Dr. Wright said, encourage physical exercise, encourage routine as much as possible, because one thing a lockdown does is take away ability to have that routine, to have those standard and constant things which keep all of us going, and that's why it's big.
Thank you.